effects of ivermectin. Please allow me to share my slides. Okay, I hope you all can see my slide. Okay. All right. So I just want to highlight that you all know you have received this in the media throughout our etc. that the KKM, the Health Ministry, has been warning people of the side effects of ivermectin, and including getting fits and going to coma and dying, and everyone is scared now. Those of us doctors who were busy handling inquiries about ivermectin and later with thousands of new COVID cases, suddenly we realized that the inquiries dropped down by about 80%. That means the government's campaign to scare the people really worked. So this is what we are trying to correct the situation, because this misinformation by the government can mean many people more dying, right? So tonight, this campaign by the government to discourage people from using ivermectin has been effective, but could have grave impacts on the people's survival should they get COVID-19, because now, even if they have ivermectin, they're scared to use it. They keep, right, as we have heard earlier on. Therefore, it's my duty now to present the scientific evidence and the truth about the safety of ivermectin to counter the misinformation by KKM and the anti-ivermectin doctors. And we are asking for a royal commission of inquiry on this. And we put on notice that KKM shall be answerable for the misinformation regarding the rare serious side effects, which they promote as if these are common. So what do we know about the ivermectin, safety of ivermectin? Way back in 2002, right, this study already concluded that ivermectin is very safe. Ivermectin was generally well tolerated with no indication of associated central nervous system toxicity for doses up to 10 times the highest FDA-approved dose of 200 micrograms per kilogram, that equals to 0.2 milligrams per kilogram. And during the study, even though they focused on CNS, they also did not find any toxicity on the other major organs like the liver and the kidneys. Adverse experiences were similar between ivermectin and placebo and did not increase with dose, and they tested up to 120 milligrams at the 10 times the standard dose. Compare this with our recommended dose for adults is only 12 milligrams once or twice a week as prophylaxis. And this study, they concluded, demonstrated that ivermectin is generally well tolerated at these higher doses and more frequent regimen. January last year, another systematic review meta-analysis concluded that ivermectin is safe at higher doses, because the study ivermectin up to the standard dose of double the standard dose, 400 micrograms per kilogram, and higher doses showed no difference in the adverse events. So which was why in January of this year, the DG, Noor Hisham, himself in his Facebook wrote this, that ivermectin is cheap, easily available, and safe for use. Okay? So my comment is that this FB post dated 22nd January of this year, he meant that it is safe for humans, because he's not the veterinary DG, so he was commenting on the safety for humans, even though he said it is only licensed here in Malaysia is only licensed for use in animals. It's fully aware that in many other countries it is licensed for humans. So why is it not licensed for humans here? Because no company until now was keen to market it here, as there are other popular antihelminthics or those deworming drugs available. So nobody had applied. The fact remains that the DG of the Health Ministry confirmed that ivermectin is safe for humans. March of this year, systematic review on ivermectin on children. Conclusion is ivermectin is safe for children. In fact, it is even safe for small children, because up to now, the advice was not to give to children below 5 years old and below 15 kilograms. So in trying to treat worms, these young children then were deprived of ivermectin. So this study researched on those children who were below 5 and below 15 kilograms that were either deliberately given or accidentally given ivermectin, and the study found out it was safe. It was safe for smaller children even. But of course, we still stick to above 5 years old and above 15 kilograms. We have not changed the guideline, but this goes to show how safe ivermectin is. So my comment is the safety of ivermectin for those above 15 kilograms needs no further data. Safely used for nearly 4 decades with nearly 4 billion doses used by humans, including several 100 million doses used in India, Africa, and South America in just the last few months for COVID prophylaxis and treatment. And in March of this year, the largest, most comprehensive review on the medical safety of ivermectin was done by Professor Jacques Descotes, right? And he reviewed over 500 articles and web sources available up to February of this year. Okay, and he confirmed the safety that I've already mentioned before, safety on the children and on the liver and on the CNS, but he also added that it was safe for the elderly, that no greater toxicity was found in the elderly, even though there were fears that in the aging blood-brain barrier, ivermectin might cross to the brain, right? It doesn't happen. And that ivermectin is routinely used throughout the world to treat scabies in elderly people without major safety issues is noteworthy. So what do we know? It is safe for children, it is safe for adults, it is safe for the elderly, it is overall safe with very few contraindications, and for now we still do not give to children below 5 years or below 15 kilograms, and we do not give to pregnant and breastfeeding women. So the professor concluded, after hundreds of millions of human subjects have been treated with ivermectin for curative or prophylactic purposes worldwide over the last 3 decades, the safety profile of ivermectin has so far been excellent in the majority of treated human patients, so that ivermectin human toxicity cannot be claimed to be a serious cause for concern. Okay, so all those scare tactics is trying to discourage people to take ivermectin, and then you see the numbers are climbing up, right? Okay. What is the opinion of KKM itself, actually? In 2015, KKM released its guidelines for the management of scabies in adults and children to all doctors in Malaysia. All right? Inside the guideline, you'll find ivermectin in the same dosage that we are also proposing for COVID prophylaxis, 0.2 milligram per kilogram, that translates to 12 milligrams of one tablet, one capsule for 60 kilogram person. Okay, and you look at the rightmost column, it says that it is useful for mass treatments or outbreaks, which means KKM says ivermectin is safe for mass treatment or outbreaks of scabies and infestation, which is rarely fatal. I read only about one case who died throughout the world. The big question to KKM is, why then is it not safe for mass prevention and treatment of COVID-19, which has killed millions worldwide and nearly 14,000 deaths here too? You say it is safe to treat to treat scabies, but it's not safe to treat COVID, right? The same drug, the same dose. Let's look at clinical trials. Clinical trials assessing the efficacy of a drug are done only after the safety is no more in doubt. Okay? So all the ivermectin COVID-19 trials were done based on the premise that ivermectin is safe if given in the prescribed doses and regimens as decided for each trial. So these regimens were never used for anti-parasite therapies before, but were formulated by the pioneers of ivermectin treatment for COVID-19. So when they found that these regimens worked, then the scientists who wanted to do the trials then tried the regimens that the pioneers had tried. So these are some of the trials. On the left are the trials that are ongoing. There's a KKM trial, ITEC trial. So you know that they use double the standard dose, 0.4 milligrams per kilogram per day for 5 days. Right? Which means, according to KKM, it is safe to take the double dose of ivermectin for 5 days. Then the principal trial in Oxford used 0.3. Active trial in Duke University used 0.3 to 0.4. But what I want to point out is that both the principal and the active trial, the doctors decided that ivermectin is so safe, those participating in the trial need not see the doctor. Right? You can register online, and the drug ivermectin will be posted, sent to you, and from home you do self-assessment and online reporting. It is called remote platform trials. That's how safe ivermectin is. Right? It is safe to take ivermectin with remote medical supervision. Of course, they're still being supervised remotely by the doctors in charge, but they need not even come and see the doctor to be checked. Okay? And the last trial I want to illustrate here, the Coley-Wilkie study released in June. It used triple the standard dose, 0.6 milligram per kilogram per day for 5 days, and it was safe. So the point is, all the scientists have agreed, right? Up to triple dose, it is safe. I want to highlight what the KKM trial is, right? The ITEC trial. You can search this on the internet. So India write-up about the trial, they said this: we believe a high dose of ivermectin of 0.4 milligrams per kilogram per day for 5 days would be reasonable and safe to achieve our study objectives. But to the public, it tells the public that ivermectin is not safe. Indeed, up to today, there are almost 9,000 studies on ivermectin, and all the authors of human studies stated that ivermectin is safe when given in the recommended doses. Studies on escalating doses showed remarkable safety even at higher doses, and all the authors of ivermectin COVID studies said that ivermectin is safe even at the higher and frequent doses used for treatment in late and severe cases compared to the doses used for parasite treatment. And up to now, there are about 112 studies to date, and 63 of these are included in the IBM-meta.com real-time meta-analysis. So there is dispute over the efficacy, but there is no dispute on the safety. Only KKM is trying to turn ivermectin into a dangerous drug. Okay? Ivermectin is safe, right? Take home message: ivermectin is safe. So what are the side effects that you may encounter? Ivermectin can cause nausea, vomiting, diarrhea, hypertension, rashes, allergic reactions, eye irritation, dizziness, but these are infrequent and usually mild, and a few are moderate. Serious adverse effects like ataxia, seizures, coma, and even death occur only if taken for deworming of large parasitic loads and certain extremely rare genetic traits, example MDR1, or if taken during active meningitis or encephalitis. These serious side effects were mostly related to the deaths and release of toxins and disintegration of worm components, and not due to the ivermectin. The other conditions allow ivermectin to cross the blood-brain barrier neurotoxicity other than in these conditions are rare. Unfortunately, some people take veterinary ivermectin even at doses meant for large animals. If they get side effects, this can be severe. But that's their problem. We are concerned only with human ivermectin. Right? Some of the anti-ivermectin doctors here trying to highlight one or two cases in the journals about CNS complications. All right. So if you look at the journals, those journals that report those cases also say serious neurological side effects are rare. For the liver, the same thing also. You have seen the local doctor saying, I've got COVID patient taking ivermectin, and then the liver is damaged. Well, they forgot that COVID-19 damages the liver much more frequently than the drugs. Okay? The clinical studies, the research papers show ivermectin is safe for the liver. And let's zoom into the studies on COVID-19, right? So the research says, in the trials of ivermectin to prevent SARS-CoV-2 infection, that is COVID-19, the cause of early as well as severe ivermectin, severe aminotransferase elevations were not uncommon, but were no more frequent among patients receiving ivermectin than among those receiving placebo or comparator drug. Okay, so this is published in the peer-reviewed journal, all right, but they're trying to scare us by giving reports of their patients with high enzymes, but don't want to blame the COVID. So what happens when the COVID patient takes IVM? COVID-19 damages all organs, and the damage can continue way past the acute stage, well beyond discharge from hospital. In fact, many get readmitted with long COVID. Some take IVM, ivermectin, and the anti-ivermectin doctors are quick to blame ivermectin for the organ damage. Case in point, anti-ivermectin doctors reporting about severe liver damage in acute and post-COVID COVID patients who took ivermectin, forgetting that COVID-19 is the more likely culprit. Sometimes there's overlap of symptoms between COVID-19 and ivermectin, right? You can see the list, almost the same. The ones in bracket will be less, all right? So COVID-19 has less vomiting and less abdominal pain, whereas there's more vomiting as a side effect of ivermectin, but still there in both lists. I have highlighted conjunctivitis because I have two cases, two COVID positive patients. They started on ivermectin and then they had conjunctivitis. I had to advise them, say, sorry, maybe it's a side effect, because we have to be cautious. Already we are prescribing and advising them to take a drug that is not registered. And if they develop side effects, now we are putting ourselves more in trouble. But at least one of them then did research and found out that his red eye was exactly the picture of the red eye of COVID patients. So he told me, doctor, I'm going back on ivermectin. I know it's a COVID-19. So when these symptoms occur in COVID-19 patients who are taking ivermectin, the blame will likely fall on ivermectin. If then the ivermectin is stopped, viral replication resumes and the disease gets worse. Right? So that patient was smart, resumed ivermectin and recovered. So should we be worried about accumulation, intoxication? We know so far that a single dose of up to 10 times the recommended standard dose is safe, so taking one dose per week should be very safe. Repeat dose given every 4th day only causes minimal accumulation, even if higher doses are given, and the repeated doses of 60 milligrams was tested and found to be safe. So twice weekly dose of the standard dose must be safe. Some studies use only 2 doses of 0.2 to 0.3 milligrams per kilogram, 2 or 3 days apart for prophylaxis, so this must be very safe. Our prophylactic dose is 0.2 milligrams per kilogram once every 7 days. So there is no report of toxicity from thousands who followed this globally over the last 1 year. And we just heard that Dr. Lenny said some of his colleagues have been taking for more than 1 year. Right? And FLCCC has advised us to increase the dose to twice a week since the 11th of August because of this more aggressive Delta variant and other variants to come. And we also know, as I highlighted in the studies, the proper studies, and in the treatment regimes used in many hospitals throughout the world, that treatment doses of up to triple the standard dose, 0.6 Dr. Lenny and Dr. Saad saying up to 10 days at these doses are also safe. Okay? And these doses have been given to thousands of patients globally and have not caused any problems. So, conclusion. Ivermectin is a safe drug, right? Taken for prevention at doses of 0.2 to 0.4 milligrams per kilogram per week. Ivermectin is safe at the treatment doses of up to triple the standard dose, 0.6 milligrams per kilogram per day, up to 5 days, 5 to 10 days. Side effects are mostly mild. Serious side effects are rare. Okay? And for liver toxicity, Ivermectin safer than paracetamol. You've heard another previous speakers were saying this. So don't get conned by saying that Ivermectin is toxic to the liver. Paracetamol is even more toxic than Ivermectin to the liver. Many Ivermectin side effects in COVID positive patients may actually be COVID-19 symptoms wrongly blamed on Ivermectin. But still we need to remind, although it is safe, Ivermectin is a prescription drug and should be taken under medical supervision, even if remotely. All right, right now I'm advising my patients all through WhatsApp and phone calls. So I end with this, right? What's more important? Using a low-risk drug that has some evidence that it works, or death while waiting for more evidence, which is what the KKM and Dr. yang sewaktu dengannya is still insisting, but the numbers are climbing, 200 every day, we're adding up over 200 related new deaths. Now we're approaching 14,000. How many more need to die? So my plea is, even if you don't want to use Ivermectin and you're happy to see these death numbers, don't stop us from trying to save lives. That's the plea from a doctor. Now, a message to the people from Malaysia, from this Dave Esprit. It is a doctor's job and right to select a drug that has more benefits than risk. And it is your right to choose to take it or not. Right now, across the world, medical authorities influenced by Big Pharma are taking away a doctor's right to choose the best medication for you, threatening us with raids, and now also the police also have sounded that they might get into the picture, all right? So those of us doctors, we have not, of the doctors here, right? We have not silenced ourselves. Because we know that Ivermectin can save lives, we will try to save lives in spite of these threats and in spite of these people. So it is our lives, it is our right to choose what is best, it is our right to choose life and to take Ivermectin. Thank you very much.